Ms. Boebert from Colorado.
Thank you, Mr. Chairman, and thank you to Comptroller Dodaro for joining us today. It is this committee's responsibility to investigate the root and root out causes of waste, fraud, and abuse and mismanagement. Noticeably, this year's report indicated that the Department of Health and Human Services leadership and coordination of public health emergencies, even though COVID is over, and the unemployment insurance system, it was added to the high-risk list after the Biden administration has continued to fumble the ball when it comes to responsibly managing taxpayer dollars regarding COVID management. Comptroller Dodaro, for some background information, what are some of the ways that certain agencies and programs are added to the high-risk list?
Yeah, we consider a number of factors. One, we do ongoing work at GAO all the time across all areas of the federal government. So we look at our institutional knowledge of these issues. We consult each inspector general, lists what they believe the top management issues are in each of their individual agencies across government. So we consult that. We consider the amount of money that's involved. There has to be at least $1 billion. And we look at a lot of qualitative factors as well, the impact on public safety, for example, and other matters.
Thank you. The high-risk list this year included one very notable addition, the Department of Health and Human Services leadership and coordination of public health emergencies. Can you elaborate on their failures of this program?
Yes. I'll ask Jess Farb, who's our expert in the healthcare area.
Thank you for the question.
Yes,
so we looked at HHS's response to public health emergencies over decades. So not just the most recent emergency that we're all familiar with, but response to Zika, response to natural disasters, responses to Ebola. And so looking at that, we found that HHS did not have a number of things in place that would have helped with this response, including understanding roles and responsibilities, the capacity of their partners, communicating clearly with the public, being transparent about actions that need to be taken. So there were a number of things that we observed over time across multiple public health emergencies that allowed us to sort of come to the conclusion that they needed to be added to the list.
Yeah, and I want to keep it visible to the American public and to the Congress, because I don't think we're anywhere near as prepared for the next emergency as we need to be.
So have these leadership failures at HHS contributed to other, it sounds like it does, other health emergencies like the baby formula shortage, the crisis at the border, and the several other natural disasters that took place just last year?
HHS is a very complex department, as we all know, and having multiple components that both need to act independently but also work together. We were talking about this earlier, how agencies need to coordinate not only across the government, but also even within the department. And this is a case with HHS that they need to do more coordination within the department to respond.
The report found that the GAO has consistently found deficiencies in HHS's ability to lead the country's preparedness, as mentioned, and response for more than 10 years, which is quite literally their job to do. According to a report published in January of last year, you identified 246 total recommendations for improving federal operations at HHS alone. How many of your recommendations has the Biden administration implemented?
I believe we'll have to get back to you with an answer on that for the record. I don't know off the top of my head how many they've implemented, but they have implemented some recommendations. How many of that total number, I can't give you the number today.
Yeah, and I would say, HHS is one of the agencies that has a relatively lower percentage of implementing our recommendations than is a norm across the federal government. So we're trying to work to increase that, and whatever help we can get from the Congress, we'd appreciate.
Thank you. I look forward to assisting in that and hearing that we have bipartisan support and getting Congress to act to assist you in that. I think we should put that as one of our priorities here. Another notable addition to this list is the unemployment insurance system. In your report, you indicated this addition is largely due to large amounts of fraud and improper payments, which have come at a huge cost to taxpayers, of course. Did the rate of these errors in unemployment insurance systems increase throughout the 53-week extension from this administration?
It's been going on since during the entire pandemic, yes. Tom, would you like to add?
Yeah, the improper payment rate went up. It's now at 22%, but that doesn't include the Pandemic Unemployment Assistance Program, where we expect that the improper payment rate is higher than that.
Thank you. My time has expired, and I yield. Thank you for your answers.